Someday, the new baby will play with Big Brother's toys. Might even inherit that precious baseball glove. But the formula he grows on must be his own exclusively. All babies are different. That's why hospitals send more babies home on formulas made with pet evaporated milk than on any other form of milk.
Before I had Albert, I didn't really know anything about breastfeeding or whether I was going to breastfeed. And then I got pregnant. I have epilepsy, so it was quite a long process before we could even try to conceive.
Before I had my child, I was aware of breastfeeding. It wasn't something that came to the forefront of my mind when I thought about pregnancy. But it didn't offend me either. If I had a friend who was breastfeeding, fine, you know, happy. It's not something that really I thought of.
My baby was born early, 6 weeks early. However, being diabetic, we produce, I don't know why, but we produce bigger babies. So Jack was on the scale, he was measuring at the 99th percentile, which meant he was, if he'd have gone to term, he'd have been about 10 to 11 pounds. So they were going to induce us around 38 weeks. So he was only really like 4 weeks early based on that plan. However, the growth scan at 36 weeks with the midwife appointment to discuss feeding and sort of postnatal care, that never actually happened. I went on the Thursday morning for an insulin checkup. That was at 9 AM and Jack was born at 10 to 3.
The day that Jack was born, she'd only gone into hospital for a diabetes appointment. And then I was at home, everything's fine. We're still thinking, you know, he's a month away from when he's due. And then she texts me saying, you know, they're just going to keep me in to monitor blood pressure. Can you bring my overnight bag? There's no mention of Jack being delivered at this stage, so we had bags prepared for that situation. So I took her overnight bag, nothing for the baby, because there was no, and so I got to her about 12:30. And then at 2 o'clock, we were visited by the anaesthetist who said, so you're having your baby this afternoon?
Albert was born after 48 hours and forceps and an epidural. Very stressful, very hard work, but we did it. She came out and we didn't know we were having a girl. It was amazing. And she was put on my chest and I was quite keen on everyone kind of leaving me to it, and that was based on reading and some stuff I'd done and hypnobirthing and stuff. They wanted to weigh her and I said, no, you don't need to weigh her now. Anyway, within about 10 minutes she was feeding, which was incredible. And then from that point onwards, we exclusively breastfed.
My views on breastfeeding are quite complicated, really. When I had my daughter a few years ago, I breastfed, but it was a difficult decision because I didn't know how other people would react to it. You know, whether it would be, well, not convenient, but allowed in most places. People are afraid of it. People are uncomfortable with it, and it's for you as well, just having had a child. Obviously, you're all over the place. You don't know in yourself, you're not confident with anything, especially with it being my first child. You don't know, it's fear of the unknown, really.
After I gave birth, I realised that the support from any health professional, regardless of it being, whether it be breastfeeding support or otherwise, it just drops. And I found it really frustrating that I was finding it difficult to get any support and I was asking for it. So I was thinking of those that may not have the confidence to ask for help. And it was just baffling that I was at that time absolutely dropped, and there was no follow-up support.
I'm type 1 diabetic, and I'm hooked up to an insulin pump all the time. So I didn't know what sort of effect that would have on sort of breast milk if I produced any, if it would have an impact on the insulin levels in it, which would affect Jack.
We had discussions, yeah, and again that was largely based around, you know, I don't know whether I would trust my own milk to be safe for Jack. What do you think we should do? And, you know, so I think we probably in our own minds thought we'd be formula feeding from a bottle even before we'd have any conversations and advice, just because we knew about the diabetes and were worried about how that might affect a baby if she did breastfeed.
Antenatally, I got no support at all regarding the impact of the medication on breast milk or breastfeeding. And it was only when we started breastfeeding and realised that that was the journey we were going to take, the route we were going to take, that I asked my health visitor. And, I mean, I want to be positive, but she said, oh, I'll look into it. This was over the phone because obviously we were going through lockdown and COVID. It was quite a strange time. So no face-to-face meetings, appointments. And she said, yes, that's a really good question. I'll get back to you. And a week or so later, I received in the post Epilepsy Actions Guide to Breastfeeding. And that, having a baby, and I think there was a section on breastfeeding. And that was it.
So as a father, I'm a father of 3 boys, and we tried for all of them to be breastfed. Certainly my 2 older boys, it was very uncomfortable and very painful for their mum to do that, and there wasn't really much support.
In 2017, I had my 3rd baby, and I felt like it had taken me to this point to really understand breastfeeding and how to do it and what it was about. And I became more and more interested then in supporting others, particularly on Facebook, because I was at home with a small baby and Facebook is easy access. And I started to get involved with breastfeeding organisations and things, and I ended up at the baby-friendly UNICEF conference that year. And I sat in this lecture hall and there were 3,000 people in there, predominantly women, and we were listening to incredible presentations, high quality evidence being delivered by amazing speakers, and the message throughout was doctors don't seem to know the right information, they don't seem to understand breastfeeding, they're perpetuating these myths, and here's the evidence that says that those myths are myths.
My name's Emily. I'm a doctor from Liverpool. I'm an IMT trainee, so I'm currently a registrar grade, but I had my first son when I was a medical SHM. I always wanted to breastfeed. I didn't really know why, and I didn't have much education or reasoning for wanting to breastfeed. I just, you hear, don't you, breast is best. But I'd say probably what we struggled with most would be our expectations around breastfeeding. And I think we had quite rigid ideas of how it would go and how often they would feed and how long they would feed for and what it would be like. And I think it's quite difficult when the reality doesn't quite match those expectations and you feel like you're doing it wrong or you feel like your baby's doing it wrong.
What position does breastfeeding have in the public health domain? I think definitely over recent years a much more important one. I think that there is a focus now on the first 1,000 days, so we understand the importance of what happens in a child's life in that first 1,000 days and what we can do, what are the things that we can do to influence for that child to have the happiest, kind of healthiest start in life. We also know that what happens to children influences their behaviours as adults. So in public health, I think we take a holistic approach to that. I know that where I've worked before, there's a big push for breastfeeding. And it's difficult because a lot of mothers who've had a baby want to breastfeed, but the support necessarily isn't there.
I set myself some targets. I said, right, I'm going to try and get to 6 weeks. Right, let's get 6 weeks. Let's do that. 6 months. Yeah, we can do 6 months. Got to 6 months. And then I thought, right, I'm going to aim for a year. And of course, we started weaning at 6 months in terms of introducing food. But Alba's such a big fan of milk. She still is. So we just continued with milk, and we actually introduced food, I think, maybe 7 or 8 months, or 7 months. But she didn't really eat anything, which I think is probably quite normal, because she was still getting so much from her milk.
I wasn't given any information. I know that on your sort of 36 midwife appointment, they sort of talk to you about, is it colostrum harvesting, and sort of prepping you for that. But I didn't actually make it to that midwife appointment before Jack was born. He was born too early. I was too poorly to go to the ward where Jack was, but in the bag that I packed, Craig took the stuff round to Jack, and within the bag that I packed was some bottles of pre-made formula. So that I presume, I didn't have this conversation, but the nurses will have seen what was in the bag and just took that and as what I wanted. I packed the pre-made formula mainly because I didn't know what to do, basically. I did buy a breast pump in the early stages of when I was pregnant, but then I thought about what effect my insulin and my medication that I have would have on Jack. So in the back of my mind, I always knew that there'd be some sort of doubt about breastfeeding.
There could have been support in terms of, could that milk, if it's been produced, be sort of tested? Can we be told whether that's safe? You know, so it's an option.
The first problem that I realised there was as a doctor, when you're breastfeeding, you think it's all going to be fine. You think you might know stuff, and then you have your baby, the problems happen, and you realise you don't actually know anything. And then not only do you not know anything, but it's very hard to find that support that you need, because there is support out there, but it, on the whole, is not medical support. And as doctors, to get that message from somebody who speaks the same language as you, that's really important, because doctors, when they talk about something, they will, use the terminology and the evidence and the things that make you really believe this is relevant to my practice. And the other problem is that when you, as a doctor, you go to a breastfeeding support group, you can feel very exposed, and the perception of the group is that you'll know this because you're a doctor, and you don't know it, and then you feel you can't answer the questions. You feel you can't ask questions. You feel you can't expose yourself to looking like you don't know and to looking stupid.
I was quite lucky the first few months when Jacob was born. There was at our baby weigh clinic that we had at the children's centre, they used to have a Bambi's breastfeeding support worker, and Bambi's is the local breastfeeding group in Liverpool, peer support one, and she would be at every feed clinic, so she was always very reassuring and would help us with that. And I noticed Jacob was born not long before the COVID lockdown, and when that all got stopped, we really missed that support. And I think as you are feeding a child, you never just get it, because there's always a new challenge. So, you might just get over one hurdle and then they start teething or they stop sleeping, so we really did miss that support when new things would crop up during lockdown. And I think we turned a lot more to sort of internet support groups. And I had a friend who was a paediatric registrar who directed me to the Breastfeeding for Doctors group.
It's like anything in public health. We know that exercise is good for us. We know that fast food is bad for us. And yet we still probably eat too much of it and don't exercise enough. So there's a real disconnect between what we know is the best thing for us to do based on the evidence and what we actually do and what our behaviours actually are. So I think that's the same with breastfeeding. People know that it gives, and the evidence shows that it gives your baby the best start, but there are lots of factors that influence why people choose not to or can't or want to and can't, and a lot of that is around the support that people have, I think. So we know that breastfeeding gives babies the best start. It's good for mum's health, it's good for children's health, it protects us years on down the line, and it protects women's health, reduces your risk of breast cancer and ovarian cancer years down the line. So the reasons why uptake is reduced are complex, and in public health it is our job to understand those complexities.
No, prior to my children being born, I had zero knowledge, completely not on my radar whatsoever. Didn't know anything about the nutritional value, the growth hormones, the colostrum, knew nothing about it whatsoever. I suspect, knowing what I'm like as a person, I probably wouldn't have been involved in feeding at all, if I'm honest, because like you say, the whole process of breastfeeding, I don't know the equipment used, the pumps and things, and it obviously with Jack being, taking it from the breast, I just think I wouldn't have been involved, whereas formula feeding, I'm helping make the bottles up, he's sitting on my knee while he's been fed, so you're a lot more involved as a dad. As a father, you will wake up for the feed during the night, and although if your partner can't breastfeed, I became more involved. So I'm now feeding my children. So I'm letting my partner sleep while I can be there and help.
James surprised me in all sorts of ways since him becoming a father. I knew he'd be a good father, but he's just so supportive and so open-minded, and he's very, very proud of us for breastfeeding for so long, or breastfeeding at all. And I don't know whether he'd be happy for me to continue until Alba's ready to give up. And he thinks it's really magical, and actually I think he's a bit jealous.
As a dad, I love being a dad. It's the best feeling in the world. And being able to get up in the night and feed your child and soothe them and get them and change them and put them back to sleep, it's one of the best things you can do. And I felt much more involved. So yes, I think the first option is breastfeeding, but as a father, I really enjoyed it. I loved getting up. I had no problems getting up in the night whatsoever and feeding my son.
In terms of professional advice, we were discharged from the health visitor at about 8 weeks. At that appointment, she felt Jack had a milk allergy. She thought he had a rash on his face. He was really uncomfortable with himself, a rash on his skin. I took him to a GP like any normal person would do. They reassured me that Jack just had baby eczema and baby acne, which all babies get when they're born. It's just dry skin. We tried him on some lactulose, but I think she was sort of misinformed.
Well, education is really important throughout a woman's life so that a woman can keep themselves healthy. That's so important, and having a women's health strategy now needs to be put in place. But also, if we look at right from that antenatal stage right through to when you're on the ward, having given birth, then to the follow-up afterwards, right through that process, a parent may need support, build their confidence at breastfeeding, and have the help that they need. Of course, not being a health visitor or a health professional in that field, I'm not qualified to give that advice, but clearly a professional would be in order to ensure that a mother gets the best care possible and the child obviously getting the best support that they can through that period.
The drive to breastfeed for me was the amazing connection you have with your baby. I experienced such a wonderful connection and bond with her, and it's a connection like no other. Those beautiful moments where you're feeding and your baby's looking at you and you can see that they are in the right place, they're exactly where they want to be.
Given the chance, I would have liked to have tried to. I don't think it impacted on the bond that I have with Jack, but I think it's something that as women our bodies are made to do, and I didn't get to try that, and it's highly unlikely that I'll be having another baby, so that's past now. That.
And what people see and what people hear every day is that currently formula milk in our country is much more familiar, much more a perceived acceptable way of feeding your baby. It's marketed in a way for convenience. It's marketed to families so that they see formula feeding as convenient, as less time consuming, as it's a way of sharing responsibility and sharing, caring for baby. Which absolutely that can be true for some families, and I'm certainly not here today to say that formula milk is bad at all. I'm not saying that at all. But what we do want to see is more families understanding a little bit more about the health benefits of breastfeeding, and I think this starts way back in school.
As medical students and as doctors, okay, we might not be trained in breastfeeding, but we are trained in things like, if you don't know the answer to something, don't make it up. Be honest, transparent, say you don't know, and try to, number one, have resources that your patient can refer to or refer on yourself. And number two, identify that gap in your knowledge and try to learn about that. And we are required to do that by the GMC. So it baffles me really that doctors think that they can, number one, perpetuate myths that are not established in evidence at all about breastfeeding. Number two, that it's okay to just make it up, the advice. And number three, that they wouldn't then seek to educate themselves when they realise they don't know the answer to a question.
Maternity services across the country, there's a commitment for all of those to be BFI friendly, baby friendly, initiative friendly by 2024, which is a really, really positive thing, really positive. But we also know that there are a huge number of gaps in the health service at the moment in terms of the education of healthcare professionals. We are finding quite often that people are coming to us having received some inaccurate information from particular healthcare service providers, quite often GPs who obviously have a huge range of issues to cover, but often haven't had the same level of information and support understanding breastfeeding.
There's a lack of education, not only on breastfeeding, but on diagnosing issues with black bodies. So that's a real massive gap. I also have to say, in my experience, that it's actually racism as well. People think that, how could a doctor, how could a nurse, how could somebody who's helping or supposed to be helping people be racist? It's not like you can be a racist just when you go home. If you're a racist, you're a racist, and you don't leave your racism at the door when you come into work. So that's a massive issue as well. And again, all along the maternal journey, through pregnancy, through birth, and the postpartum and postnatal period, we come up against racism in the system. These are the things, these little microaggressions that actually are kind of macro, comments like that seem quite, innocuous, no biggie. But when you get them day in, day out, it just can destroy our breastfeeding journey, completely destroy it. And so these are the kind of things that we're coming up against. The groups maybe not being as inclusive as they could be. The people who are running the groups, I ran a workshop, it was last month, for birth educators, teaching antenatal courses. And I spoke about working with black families. And I had to take it back to basics. I had to take it back to, we are human beings.
We hear a lot of questions about positioning for breastfeeding and latch and the kind of things that probably people who've had experience of breastfeeding would expect. We have queries about mastitis. On the Drugs in Breast Milk helpline in particular, we get queries both from mothers and families, but also from a lot of healthcare professionals about whether somebody can continue to breastfeed when they're taking various types of medication. So in addition to that service that we provide, which is run by trained pharmacists who are also having experience of breastfeeding themselves, we also do provide evidence-based fact sheets, which we know are one of the most popular services that we provide, actually.
So fast forward now onto my work with mums and families as a doula. What I love to see is the majority of black mums that I come into contact with are really keen to breastfeed, and I think that's fantastic. The only thing is that sometimes the support isn't there for them, the right, support, the good support. And oftentimes in the group, when we talk about breastfeeding, I say, have you tried, the infant feeding team at the hospital? Have you tried any of the breastfeeding cafes, the baby cafes we have around Birmingham? There are other sources of support out there, but oftentimes we're not aware of them. These kind of groups are advertised and pushed in, online birth groups, Facebook groups. If you're not a part of that group, or if you don't feel that you're made welcome in those groups, you're not going to get that information. You're not going to be part of the conversation, is what I say.
We know that 80% of women actually set out with a full intention of breastfeeding, and we are letting them down. 81% of women are deciding that they want to breastfeed. They're starting out breastfeeding. Many are giving up before they want to. And that is not the fault of those women. It's not the fault of the families. For some people, it doesn't work out. But for many women, it could work out with the right support and information. As a society, we're letting them down. We need to be spending more time delivering our high-quality services to a much larger range of women, adapting our services to the specific needs of specific communities of women, and a lot less time assuring that we've got the finances, the basic finances in place to run those services. And I would say that is a major thing that the UK needs to change.
One of the greatest success stories, really, of the 20th century, I've forgotten what century we're in, of the 20th century, was the Formula Industries marketing campaign. I honestly think we can all learn so much from how they've done that. They were hugely successful. Over 50 years, they obliterated everything that we know about as a society, that we know about normal infant behaviour and development, and they undermined breastfeeding, all so that they could sell a product and make money from it. This has been at the cost of millions of infant lives, not just in developing countries, also in what we call developed countries, but this tragedy, this absolute tragedy, is why these myths persist, because formula marketing has made sure of it. There was a lot of money involved. The Lancet Medical Journal recently in February, launched their third series on breastfeeding. And this theme is all about formula marketing and the damage that it has done and why it really has to stop. We have to stop this. It really is costing children's lives, and it's also costing the mental health, and has a big effect on perinatal mental health. And another very important report that comes out, I think it's every 2 years, is the Embrace report, which is the mortality in and around childbirth. And there are too many numbers of suicide postnatally and perinatally. And I think that the culture that we have now around breastfeeding and around our expectations of infant behaviour, based on what the formula industry has done to those cultural expectations and knowledge, are largely probably responsible for a number of perinatal deaths as well. So we're not just looking at children, we're looking at mothers. And we're looking at children who don't have mothers.
The challenges at the start for me that were so frustrating was other people's opinions. You know, if she was unsettled, or if she wasn't latching, or if she wasn't sleeping, I was constantly met with, but just put her on a bottle. And I just thought that was so crazy that people thought that that was the answer to our problem, put her on a bottle over her own mum's breast milk. So it was outsiders' opinions that was a challenge for me. Um, I just did not like people saying that to me, and that made me more determined not to put her on a bottle. Even though initially I thought I'll just see how it all goes, but as time went on, and I think you start getting really attached to it, and you become you start becoming really proud, and especially when her weight was gaining then every week. But to be met with, put her on a bottle, put her on a bottle, it was almost as if I was doing something wrong by trying to feed her myself.
And we know that breastfeeding is environmentally friendly. It doesn't require any extra resource, no water. Mums don't need to have extra food or fluid at all to make their breast milk. So, and it comes, you know, it doesn't need any packaging and there's no additional waste. So when we started looking at, you know, breastfeeding and climate change, we also explored the other side and looking at the impact of formula milk on climate change. And we know that formula milk is made from cow's milk, and cows have a huge impact on the environment. But also when formula milk is made, it needs to be packaged. It needs water in the making of the powder itself, but then also the kettles to boil the water to make up the milk when mums are feeding at home. That obviously impacts on things like using electricity as well as the water. And so the formula milk comes with a high carbon footprint, and breast milk comes with a very low carbon footprint. So, you know, we just sharing that information. It's not about saying that, you know, formula milk is bad and that we shouldn't be using it. We know it has its place. But it might be another reason why families might think actually that's, you know, something that they want to do for their babies and for future generations.
How do the cattle that will be used from which we get the milk, how do they feed? So that's another major impact. So in this, in Western world, they are probably fed with maybe wheat or other crop-based product. And if you think there are places where there is still hunger and food insecurity, some of those could have gone into providing food security within other societies. And I'm assuming let's assume most of the cattle that are being used for those milk is from this society. If it is from, say, less developed countries or the global south, what you see that might happen is rather than cultivating corn, maize for human consumption to reduce food insecurity, they might end up sell that to farmers who will be able then to use it to feed the cattle to make to make formula feed. Then that's another link, and that has a lot of social justice dimension just beyond the environmental issues. Also, we can think of the packaging. Definitely breast milk doesn't need packaging. It comes natural, but we can think of the packaging of formula feed, either in tin, I think. It's in tin, and you can think, again, that tin is extracted from the environment. That's more extraction of tin or if it's from different aluminum or different metals that then need again to be extracted from the environment.
Well, the environmental factors which are rightly drawn out around the use of formula should be very much put in the focus of government. I feel that this isn't on the government's agenda at all, but it really should be. But this isn't just about ensuring that the product itself obviously is of the highest environmental standard, we're talking baby milk, but also you think about packaging. And of course, there has been a consistent campaign about the way that formula milk is promoted. And obviously, there is the kind of big focus on Nestlé, a local company to York, about ensuring that there was an ethical policy around formula. And what we did see was a real driving a product forward into communities that then could not afford the product. And of course, that meant that babies weren't properly fed. But even here in York, we hear about stories where people are watering down formula because they simply can't afford it. So there's a range of reasons why it's so important that babies get the best nutrition. And I think what we should be talking about is what's best, and then building up all the reasons why and of which the environment is part of that.
If there's an environmental catastrophe, say flood or drought in a place, in a community where people depend on formula feeding, then the cattle are destroyed or they are killed or whatever happens to them, then that becomes an issue. It could have an effect on availability of formula milk for the kids, and it can be a major health issues, nutritional issues for the kids, because it's not at that point you want to start introducing them to breast milk. But then, even if flood happens and a child is being breastfed, we hope flood doesn't happen. We hope the environmental catastrophe don't happen. But what happens at that case is you just need the mother to be alive for the baby. So it's quite less impact of any climate hazard or climate disaster when a child is being breastfed. So you have that food security, so to say, for the child.
After lockdown, I was coordinating a zero waste parenting program, and one of the modules was about infant feeding and the link of our infant feeding decisions with sustainability and the impact on the environment. So it was a really interesting topic, and we had a really good turnout for that particular module. And during it, we discussed the fact that our council area has got amongst the lowest breastfeeding rates in the world in Derry City and Strabane District Council. Northern Ireland has the lowest breastfeeding rates within the UK, and Derry Strabane Council have the lowest breastfeeding rates within Northern Ireland. So any breastfeeding on discharge, we're actually at 37%. Whereas Northern Ireland is 49%. According to the World Health Organization, that should nearly be 100%. And unfortunately, exclusive breastfeeding on leaving hospital in the Derry City and Strabane area is actually 27%. So just over a quarter of mums are breastfeeding exclusively leaving hospital.
Well, within framework agreements around family-friendly policies, of course, employers do have flexibility to go further, but the policies which do exist should be extended far more. And I think looking at a 52-week window, being far more generous than where the law sits, is really important. And we should be prioritising that for all mothers to be able to have that time and to get properly paid. But pay is a major issue in this about somebody's decision, because if you cannot afford to stay at home, then you will have no choice but to go to work. And I think we absolutely have to recognise that any policy has got fiscal consequences and has got to be underpinned by budgetary considerations. And therefore, if the state values those early years, the 1001 critical days, which it does say that it does support, then it needs to turn not only those warm words around, but also to ensure that money is put on the table to support mothers during that time.
For example, if a woman's returning to work and asks their employer to change their start and finish time to enable them to continue breastfeeding, that's a flexible working request. The employer must consider it, but they're not obliged to agree to it. And also they're not obliged to make a decision quickly. So women may find themselves on the verge of returning to work and really unsure about what their situation is. And if they make a request under health and safety legislation, then the employer's obliged to look at the risks that face them. But the obvious response, which is to provide time off to breastfeed, and breastfeeding facilities are not required by law. They may move the woman to a slightly different position or make some other arrangements so that she can rest, but they don't require employers to provide the breastfeeding breaks and the facilities to support them to breastfeeding work. So there's a lot of uncertainty, and there's not a lot that women can do if their employer doesn't accommodate their needs.
You really need that visible support from senior leadership for a family-friendly approach to work, because they're the role models and they're the people that other employees look to as to how they should behave in the workplace. Having that open and supportive culture so that employees can have the conversations that they need to have and find the support that they need is vital. At Working Families, we have our Top Employers for Working Families benchmark, which is a survey assessing all aspects of your family-friendly and flexible working policy and practices. We work with over 160 employers in the UK, and those employers that complete our benchmark, around 90% of those employers say they provide support for breastfeeding mothers. Now, those are the most progressive employers, so we know that those progressive employers are making provision for breastfeeding mothers, but we know that there's so much more that can be done. We would suggest that employers have a policy statement on breastfeeding. It doesn't have to be a standalone policy. It could be included in a maternity policy, and it just states the organisation's support that they provide to breastfeeding mothers, and also gives that assurance and emphasis that it's important to them as an employer to support their employees.
There's a lot of uncertainty, and there's not a lot that women can do if their employer doesn't accommodate their needs. There's been a few cases run in the tribunal and the courts on breastfeeding rights, but again, these are not particularly powerful decisions. Employers have to assess the risks to women, and they have to make adjustments if they've identified risks. But again, women are left with enormous uncertainty about what their rights are, and if an employer doesn't offer them support to breastfeed on return to work, they really are left with perhaps a discrimination claim in the employment tribunal, which few women have the time, money or energy to pursue, and it certainly doesn't provide a swift resolution for the problem which a woman needs if she's trying to continue breastfeeding when she returns to work. At the same time, the maternity, paternity and shared parental leave framework doesn't really support women who are breastfeeding. The various health agencies recommend exclusive breastfeeding for the first 6 months. However, if you look at the leave and pay provisions, this is invisible in that space. So there's compulsory maternity leave for 2 weeks, 4 weeks if you work in a factory. There's up to 12 months of maternity leave which women can take, or they can transfer some of this to their partner. But there's nothing in there about breastfeeding rights. If you actually want to promote take-up of leave by fathers and partners, you have to make sure that women have the option to continue breastfeeding when they return to work.
Returning to work, I think, is a bit of a point where people think, oh, it's time for me to stop now because I'm going back to work. So I think there's work to be done around that. How do we help people to go back to work who want to do it? For some people, it's not an issue because they may work from home or they've got access to expressing facilities, but I know my experience as a doctor was that I was working long shifts, long hours, holding a bleep. It was quite complex for me to go to work, but I was very motivated to do that. And in my kind of supportive work with breastfeeding for doctors, we've now got a network of people who say, how am I going to do it? And I think that's what was like, even just 10 years ago, there was nobody to say, oh, I've done it. This is how I did it.
So I was really fortunate. I worked for the local authority, and they are, by and large, a bit more flexible and supportive, especially with family. But I was fortunate that I was working from home. Post-COVID, we never went back to the office. So I was in the lucky position to be able to express at home if I needed to. But my manager knew that I was still breastfeeding. And I think if I said to him, and I was coming into the office, that I needed some time to express, I think he would absolutely be fine with it. But I wouldn't say that there was any specific facilities for it. I also worked with the waste departments and where the big recycling vans are kept, and the kind of the manual labour side of local authority, so the carpentry and the gritters and stuff. So without stereotyping, there were lots of men there, lots of kind of burly men, and I don't know how comfortable I would feel sitting in the canteen expressing.
Employers should be providing a comfortable, convenient, private room for mothers to feed their child or to express, with an electrical socket and a fridge to store the milk, which is separate from that of other employees. And they will need some flexibility in the day. So employees who are breastfeeding will need to take those breaks to be able to feed or express and also to rest. So it's really important for the employee to discuss those requirements with their manager. And we would suggest perhaps using time during a keeping in touch day to have that meeting to put things in place before the person returns so that those provisions can be put in place and a plan can be made to support the employee.
Well, the whole area of rights around pregnant women right through to new mothers needs to be addressed. And if we think 50,000 women are unfairly dismissed because of being pregnant, you've got to question what penalty is being placed on employers, which are clearly in breach of the law as it stands. So I think we need cultural change as well as clearly very user-friendly employment rights for individuals. And of course, if you look at that in the kind of antenatal phase, then obviously you should be looking at that as well once the baby has been born and parents are returning to work. So there's this whole area about supporting mothers, new mothers, for that period when they're off work, but then when they return to the workplace, what flexibilities are put in place, what support do they get to enable them. And of course, for a business, what I would say is get this right, and then you retain your member of staff. You'll see greater productivity from that member of staff because they'll be able to focus on their work as well as obviously being able to provide the support for their child. But into society, breastfeeding, is not just about nutrition. There's issues about bonding and nurture and support for that child, which are really important about building securities around that baby as well. So if you look at those wider issues, it will give a much more secure relationship between parents and child. So all of these issues are so important to put into the whole realm to say that actually, if we really, really do value women around their nurturing their child, if we really value babies and see that it's important to invest in them, then we've got to get the policy framework right to support that. And 1001 Critical Days really does set out a progressive agenda, but government need to rise to put that in place.
And we've just covered the family-friendly rights. We have discovered, basically, that there are no rights regarding breastfeeding. Allowances should be made, guidance is given for employers, but at the same time, there's no actual rights to be able to breastfeed. And I think that that's absolutely shameful in this day and age. I really do. I must admit, I was staggered to learn that. I automatically assumed that it would be a right, that there would be legislation providing for it, but I was just amazed that there wasn't. I could not believe it.
There's many stories that you'll find of people being forced to express or pump in toilets, in their cars, in cupboards they found, and that is not acceptable. This should be something that is more welcomed and more encouraged and more available than it currently is. And I think that applies to many different settings as well, not just hospitals, places where you go. We have big issues with some of our exam centres where you go to sit an exam for 6 hours and there's no provision for a breastfeeding room or a pumping room or anything. And it can really hinder people from wanting to carry on breastfeeding when they're constantly facing these battles and these obstacles. It makes it seem like formula or like other milks are the easier option because there's no battle to give them. Whereas we should be valuing breastfeeding for what it is and encouraging it as a society, not just as a individual level.
Certainly back when the initial shared parental leave policies came in, we struggled to get parliamentarians to even contemplate the question of breastfeeding when they're looking at leave and pay provisions. We found it very difficult to influence government to strengthen protections for breastfeeding in the workplace. It's simply not important in the eyes of most of the decision makers. We worked very hard in the Modern Workplaces consultation around 2011, 2012 to try and get breastfeeding rights reflected in that, because that was a consultation around family-friendly working arrangements, so it made sense to address breastfeeding in that context. What we were able to do was to get a commitment to produce ACAS guidance on breastfeeding. So ACAS, which is the agency that assists employers and employees to resolve workplace disputes, produces guidance which is based in the law, and they produce guidance on breastfeeding on return to work. And it was a very good process developing that guidance. A lot of breastfeeding groups involved, as well as unions and some employer groups. But it's limited by what the legal framework is in the UK. So it was essentially quite supportive of employers being flexible around breastfeeding rights, but it couldn't prescribe what employers must do, because the law doesn't prescribe that employers have to offer breastfeeding breaks and facilities. We do raise the issue of breastfeeding when the opportunity arises in government, but there's been very little work done on employment rights in recent years. We've been waiting for about 5 years for an employment bill. The employment bill is the opportunity to make changes in a number of different aspects in employment legislation, and while it's been promised, it hasn't materialised. So there's very little opportunity to get government to make the changes that we think are needed in the current context. And to be honest, even when an employment bill is on the table in Parliament, I think we'll face the same problems now that we faced back in 2011 and 2012 in trying to get breastfeeding recognised as an important issue that needs to be addressed in legislation.
When a woman returns to work and they're breastfeeding, they may need some flexibility during the day in order to feed their child, express, and to take breaks. So having that conversation with your line manager about what you might need is really important. It could be that you need a short-term arrangement just lasting a couple of months, or it could be a longer-term arrangement, and in which case we would suggest that you have a trial period to test out this new way of working, so that the employee can see if it works for them, and the employer can see if it works for the team and the organisation.
Yeah, so going back to work was really nerve-wracking for lots of reasons. Obviously, it's a real change, shift from a year being with your baby 24/7 and then having to go back to work. I went back 3 days. I'm still 3 days. But to prepare for Alba not being with me and having milk whenever she wanted, I didn't really know how to prepare. I mean, how do you prepare for something like that? Being away for 4, 5, 6, up to 10 hours away from your child who's normally breastfeeding every couple of hours.
So we're not finding that HR departments are sending these mamas information before they return to work. Information like, okay, you're coming back to work, maybe a phased return back to work. How are you feeding your baby? If you're breastfeeding, here's our policy. There doesn't seem to be anything like that. Maybe there is, but maybe the mom has to go and seek it out.
What we need is clear and unambiguous rights for women to breastfeed on return to work. That means the right to paid time off to breastfeed or express milk, and it means that there are facilities in every workplace which support women who are breastfeeding. That's absolutely essential for us to be able to support women to continue breastfeeding after they return to work. And they need these rights not just so that they can challenge employers if they do the wrong thing, but so that they can try and arrange things in advance. It's not enough to be left trying to negotiate health and safety provisions or flexible working provisions when really they need some certainty so that they can plan their return to work and manage their breastfeeding and support their baby.
One thing I can say is that a Labour government will very much be focused on the health of women and right through those early years of a child's life. And I think it's really important time right now to ensure that we see Labour committing to the 1001 critical days strategy and to put in place provision for women to be able to breastfeed and to engage in a proper strategy around support for their newborn, and particularly getting that workforce in place is the first step of that, and that's something we've already committed to.
For me, it's the education. For me, it's from the very get-go. It's having it embedded, having breastfeeding embedded in curriculums, whether it, school curriculum, whether at university for medics who are studying, embed it in there and really flag the importance. We're talking about the nation's health. We need to really prioritise how they're being fed from the start. So for me, it's education. For me, it's also challenging those racist attitudes from those who are supposed to be supporting us and caring for us.
My thought with my public health hat on is a national breastfeeding strategy. I think that is, or a national breastfeeding policy with strategy, because I think that is the way to deliver what is needed. So the advantages to that are you would have the national experts, you would have a review of all the evidence, you would have that kind of irrefutable, this is good, how do we make this work for everybody?
There should be more visibility with breastfeeding, and we should have breastfeeding rooms that are available for all staff, patients, visitors, contractors, anyone who comes to the hospital who might be breastfeeding, because it's just another obstacle in the way if you have to be the one to fight for your room or to ask for it, or if you're not as lucky as I was with a supportive supervisor and you meet resistance and you're a new mum coming back to work and you're quite vulnerable anyway, and then you've got to fight this battle. I can see why so many women just say, oh, I'm not going to pump, I'm not going to carry on, I'll switch to cow's milk or I'll switch to formula, because it's hard to be that person who's causing the issue by asking for something that you shouldn't have to ask for, it should just be there.
We've seen in the US that there's been a huge issue last year around access to formula and the price hikes in the cost of formula because of their supply chain being affected. We know that during COVID, shelves were empty. So if you've started using infant formula and then suddenly you can't access that support for your baby, or you're talking about families which are already living in poverty and they're having to kind of make really tough choices quite often between whether the woman eats or the father eats, or whether they actually feed the baby and buy this formula. That's not a workable system. Obviously, we want to support breastfeeding wherever it can work. It's a more cost-effective solution. However, when it is essential for people to use infant formula, or when that's an informed choice that they've made, it needs to be something that's accessible and not likely to kind of push families further into poverty, and particularly food poverty.
It doesn't help that there's photographs of government ministers, promoting products such as Green Love, selling it to other countries, China, selling it to Africa. And this is really upsetting as well, that these products, which are suboptimal for babies, are being pushed on other countries and promoted as if they're as good as or even better than breastfeeding. So to see government ministers actively doing this, and to have constantly ads on the television, online advertising targeting pregnant women even, and where are the ads for breastfeeding? Where is the support for breastfeeding? So I think, that there's a huge, absolutely huge conflict of interest going on here in our country in relation to infant feeding, and it's very much stacked in favour of formula.
I believe we need good statute, good law to enable women to have real choices over the feeding of their child, and breastfeeding clearly is in the best interests of parents and the children if that can be facilitated. Of course, we know not every woman can breastfeed, and we need to ensure that the same support is put in place for those women that can't, to be able to have that bonding and relationship and feeding opportunity of their babies as well.